Thank you, Madam Chair.
So I'm going to call up Representative Lesh with House File 4. And as I do, I just would like to comment to members and to the audience. These are bills that we have heard before. We heard them last year. We either, and this one in particular passed was part of our omnibus bill that passed out of this committee. I believe we also had an individual, we heard the bill, and so this bill is, I think, substantially the same as it was last year. So I don't know that we're going to need a lot of, we have a number of testifiers to this bill, and we're going to keep the testimony really brief because this has had a full discussion. And so our goal is we have some minor amending to do, I think, and then we're going to be moving this out. So welcome to the committee, Representative Lesh.
Thank you, Madam Chair. Madam, did you want me to go ahead to the bill, Madam?
Yes, if you could just briefly present the bill and remind members of what we're, oh, yes, I have to move the bill, don't I? So the chair moves House File 4 to be recommended to Ways and Means.
Thank you, Madam Chair. Members, House File 4 is the anti-pharmaceutical price gouging bill. And this bill was a work between myself and the Attorney General. And the Attorney General came up with some great ideas about how we could do this. And Attorney General Keith Ellison, I'm really pleased, first of all, that he has put such effort and resources behind getting this bill heard and getting the issues in it considered, because as you just heard from Dr. Schonelmeyer, something's wrong. And that phrase, something's wrong, goes directly to the bill itself, because the bill prohibits unconscionable price increases in pharmaceutical. And those of us who don't know what unconscionable really means and have to look it up, if you look it up, it means it's not right. All you have to do is listen to the testimony of those drug price increases that happened overnight, as testified to by Dr. Schonelmeyer, and say to yourself, something ain't right, because it's not. We all know that. This isn't the natural flow of the market. This isn't the invisible hand of the marketplace, unless it's the invisible hand of a marketplace punching you in the face when you need pharmaceuticals that you rely on and that are essential to make you better or help you live. So that's what this bill does. It says if the drug is essential to you, to your health, and for you to live, and if the price increase is unconscionable, then the Attorney General steps in and takes a look at it. There are many other people here who can testify far more thoroughly about some of the details, including the Assistant Attorney General here, as well as Dr. Schonelmeyer, but I wanted to leave you with one thing. Members, I'm a veteran of many institutions. I spent 4 years studying for seminary in the Catholic Church, a big old institution. I did 17 years with the city of St. Paul. I've been here at the state of Minnesota for 18 years, and I did 8 years in the Army. And one thing I can tell you is that anytime a bureaucracy or a system gets old and big, it gets more complex. And as it gets more complex, you end up with some anti-intuitive and frankly absurd results. Just like with the pricing of pharmaceuticals right now. It's gotten so ridiculous and so complicated, given to such a long history of pharma and the system itself. Pharmaceutical companies are a part of the system. They are not the only cause of this, but they are a part of it, whereby it becomes nearly impossible to get anything other than, hey, something ain't right. So that's what this bill is about. It allows the Attorney General to stop in and examine that. And with that, Madam Chair, I would leave it to my other testifiers.
All right, well, thank you, Representative Lesh. There is an amendment, an A4 amendment, and I understand that's a technical amendment. Did you want that one moved?
Yes, Madam Chair.
All right, so the chair would move the A4 amendment to get the bill in the shape in which the author would like it. And Representative Lesh, can you explain the technical amendment?
Could I have research explain that, Madam Chair? I completely
certainly.
forgot.
Mr. Chan.
Madam Chair and members, all this does is it updates the underlying current law that the new language is amending. It's a purely technical move because the action in the bill, has moved over to this current session.
Okay.
Now I
all
remember,
right.
Madam Chair.
All right, thank you, Representative Lesh. So any discussion to the A4 amendment? Seeing none, all those in favor, please say aye. Aye. Opposed, no. The motion prevails. And then we have another amendment, the A5, and this is an amendment, maybe Mr. Berg, can you discuss this one?
Madam Chair, the A5 amendment appropriates the money to the Commissioner of Human Services that's necessary for this bill. If you look in your packets, there's a fiscal note that is a new one from this year, but it looks very much the same as the one of last year, only 1 year down the road. You'll see there are net costs at the Human Services Department of $31,000 in '21 and $36,000 a year in the tails. This amendment appropriates, it's maybe a little unusual for members who are used to seeing our appropriations, because normally our spreadsheet nets out federal participation against it, and you only see one of those two numbers. This appropriates the full amount, and then it makes a note that we expect federal financial participation to offset our costs. And my understanding is that this bill will move from Ways and Means to the State Government Finance Committee to deal with the AG costs.
Okay, so, okay with that, Representative Lesh?
Yes, Madam Chair.
Okay, so we're just trying to line it up with the fiscal note. And as Mr. Berg explained, there are, the AG requests costs in the bill to administer this, and we are moving the bill to Ways and Means, and presumably it'll go to State Gov Finance so that they can deal with the Attorney General costs that are in the bill. So, any discussion on the A5? All right, seeing none, all those in favor, please say aye. Aye. Opposed, no. The motion prevails. Okay, so now we have some testifiers, and if we could keep that really brief, and starting off with, we're going to ask people to stick to 2 minutes. We have 4 people on the list here to testify. Mr. Velzen.
Thank you, Madam Chair. Again, my name is Ben Velzen. I'm an Assistant Attorney General with the Minnesota Attorney General's Office, and I will be very brief because, as Madam Chair noted, this bill has already passed through all relevant House committees last year and was on the House floor, but not enacted into law. So first, let me start by saying that the Attorney General's Office strongly supports HF4 and believes it would be an effective manner to prevent runaway drug prices in Minnesota. Further, as Dr. Schondelmeyer just testified, recommendation number 3 of the Attorney General's Drug Pricing Task Force was to enact a price gouging statute such as HF4. So I think that from the Attorney General's position, this would be, again, a very effective way to control high and exorbitant drug prices in Minnesota. HF4 prohibits charging an unconscionable price for essential prescription drugs, which include patented, off-patented, biologicals, and generic drugs that also meet certain other requirements. And as Representative Lesh said, if the law is violated and there is price gouging on drugs, it would be referred to the Attorney General's Office for enforcement. And I also want to note that HF4 is different than Maryland's law in some important manners, in that applies only to drugs prescribed in Minnesota, sold in Minnesota, and sold to a Minnesota consumer, DHS, or a Minnesota health plan, which are small but very important distinctions from, for example, Maryland's law. So I just wanted to highlight those key points for members of the committee, and of course, I'll be around for any questions later or now. So.
All right, thank you very much. So next we have Aaron Heers-Ardle, then Judy Cook, and then Sharon Lamberton, if you could be ready to come down. Welcome to the committee. Please just say your name for the record and then go ahead with your testimony. If you could keep it to 2 minutes, we would appreciate it.
Chair Liebling and members of the committee, my name is Erin Heers-McArdle. My husband and I live in Anoka with our first grade son. I'm a fine art jeweler and metalsmith working out of my home studio, and I'm also a member of the Anoka Hennepin School Board. I'm sharing my story today to do my part in stopping unethical drug pricing. Over 20 years ago, I was diagnosed with what is now called type 1 narcolepsy. There's only one medication, Xyrem, that comes close to keeping my symptoms under control. In 2007, the retail price of Xyrem, a liquid oral medication, was $2.04 per milliliter. In 2014, it was $19.40 a milliliter. Today, it's $29.69 per milliliter. At my dose, a 180 milliliter bottle lasts 10 days, bringing the annual retail price to $192,400.56. I'm fortunate to have prescription coverage that covers all but $35 per month of that cost, but I am just one of the lucky ones. There's no reason that Jazz Pharmaceuticals should be allowed to price gouge Xyrem. As a treatment for a rare disease, this medicine was developed with our tax dollars through publicly funded research grants from the Food and Drug Administration, administered through the Office for Orphan Medical Products. There's no research and development debt to justify these egregious price increases. Medicine is a public good, but while Big Pharma spends money on lobbying and advertising, the public is paying for medicine twice, once through publicly funded research and again at the pharmacy. In the Netherlands and in many other countries where drug pricing is regulated, the annual retail price of Xyrem is less than a 1-month supply in the United States, but it's the same medicine. This greed is unconscionable. Before I had access to Xyrem, I couldn't drive. I couldn't walk 100 yards without falling down from cataplexy. I couldn't take care of myself, and I had no idea how the rest of my life would go. Xyrem gave me back my life. Too many people with debilitating narcolepsy can't afford Xyrem. Too many insurance companies refuse to cover its high cost. So many people who need medications are suffering because corporations are price gouging the medicine we need to live. Drugs don't help people if we can't afford them. We need our elected officials to change the rules. Please support House File 4.
Thank you. Thank you very much for coming to testify. And we're going to hold off on questions if you can stay in case there are any for you. Thank you very much. Welcome to the committee.
Thank you, Madam Chair and members of the committee. For the record, my name is Judy Cook with Cook Gerard Associates. I'm representing the Association for Accessible Medicines, which is the trade association for generics and biosimilars. I'm actually going to use my 2 minutes and go a little off script here. You know why we are opposed to House File 4. The triggers, unclear definitions, constitutionality, private right of action, percentages. As you know, more than 90% of drugs are generics, and they're only 22% of the cost. You heard at your hearing in Mayo, at the Mayo, that generics are actually a good thing in the drug marketplace. Generic drugs have had 3 years of deflation, lower prices, and 36 cents of every dollar spent on a generic drug is what goes to the generic manufacturer. So the rest of that goes to the others in the supply chain. House File 4 is just one of many bills that is moving through the process. You heard the Attorney General's proposals, and we really encourage you to look at House File 4 and all the others at the overall impact on the generic marketplace. There are a number of bills, as I said, and I would hope that you don't want to disrupt the generic market, especially with the promise of biosimilars and the billions of dollars of potential savings that will come when they come to the market. So we oppose House File 4, and again, encourage you to consider the impact on generics. Your goal should be to reduce cost to consumers, both in terms of patient out-of-pocket premiums and state spend. And to that end, we want to work with you on that. And while I'm here, Chair Liebling, I will just mention that on the next bill coming up, House File 1246, with the amendment, the author's amendment that is coming, AAM has removed opposition to that bill. That is the drug price transparency bill. So I'll just mention that while I'm up here, and I won't need to come back. But we do oppose House File 4, but want to work with everybody, and happy to answer any questions you might have.
All right, thank you, Ms. Cook. If you would just hang around, because we're holding questions till we get through the testifiers, that would be great. Welcome to the committee.
Hi, Madam Chair, members of the committee. My name is Sharon Lamberton. I'm with Pharmaceutical Research and Manufacturers of America Trade Association in Washington, D.C. of 38 biopharmaceutical companies. I'm a nurse by training, and I'm proud that our industry has more than 56 medicines that have been approved this past year. And we have 7,000 medicines in the pipeline, a lot of hope for our patients for new cures and developments. We respectfully oppose HF4 today. I wanted to talk just briefly to lay out 3 points in context before talking about our opposition to this legislation that has good intent, but we believe it neglects to consider 3 important things. One is that the net prices of medications have grown just 0.3% in 2018 when you take out the negotiated discounts and rebates that are accounted for. that are not accounted for, and it's only 0.3%. Also, better use of medicines. If patients were to take medicines as prescribed and use them as needed, we could save the system over $213 billion in the United States annually. And that is the most important thing we should be addressing here in this committee is insurance design. I think that's the real key because of the differences of insurance design. There's a lot of discounts and negotiations we've talked about that are not getting passed down to the patient at the point of sale. And that if we could get some of those rebates to the patients, it could save more than $800 a year for a patient without increasing their premiums just 1%. But why we oppose House File 4 today are three brief reasons, but important ones, in that price controls, which this bill truly is, will limit access to needed medicines. Insurers are the ones that determine the ultimate price that the patients pay, and price controls on patented products are also problematic. It'll limit newer treatments for patients. I can go into that more, but the second point we oppose HF4 is that price controls on patented products are unconstitutional. We do not object to state laws restricting price increases, but federal patent law preempts any provision that interferes with pricing on patented drugs. Minnesota language here interferes with the manufacturer's ability to price products, and the Federal Circuit Court did strike down D.C. legislation prohibiting any potential drugs from being sold. Also, a Maryland law in 2018 was deemed unconstitutional
wrap it
under
up,
the Dormant
please.
Commerce Clause. And then finally, we'd like to see that we know that price controls will jeopardize rebates. We've heard that from the CBO. We have $166 billion in rebates every year, $537 million, which come to Minnesota. We want to work with you all on policy solutions. This just is not the right vehicle.
Thank you, Ms. Lambert. Okay, questions. Representative Halverson, did you need to bring somebody back to the table?
I don't think I do. I really wanted to address the committee based on some of the testimony I heard. I was actually really moved by here's McCardle's testimony that we have another drug that has priced people out of being able to get a drug that's necessary to live their lives. We listened to testimony last night on the insulin bill, or listened to testimony. We debated it and debated it and debated it. And everybody said, what are we going to do about all the other drugs? This is what we're going to do about all the other drugs. And frankly, that was all I was going to say until I heard the testimony from Pharma. And when I heard Pharma saying that that it is the patient's fault that drugs are too expensive, I have to say something, that it's the patient's fault that patients are not using their drugs as prescribed. Patients consistently come to me and come to everyone around this table and say that they are not using their drugs as prescribed because they need to pay for a roof over their head and they need to pay for food for their kids, and because their drug prices are too expensive. I also heard the pharmaceutical companies blaming the insurance companies for the high price of prescription drugs. There's no doubt that the pricing scheme for healthcare is complex, but I will tell you this. One of the #1 drivers of premium increases in this state and around the country are the increasing prices of prescription drugs. We need the pharmaceutical companies to stop gouging patients because people can't afford their premiums, and if they're uninsured, they can't afford their drugs. And that means that we lose lives, and we lose health, and we lose productivity in this country. I will not abide anyone blaming patients for the high price of prescription drugs.
Thank you, Representative Halverson. Representative Lash?
Thank you, Madam Chair. And thank you, Representative Halverson. When I even Dr. Schoenemer, I will tell you, and everyone else on the task force, when we had our press conference last week, they had a chart up there, okay, and it had a lot of lines on the chart with the reasons for why pharmaceutical prices have gotten so ridiculously high. And what they stressed in the press conference was that this is a very complicated system, and everyone plays a part in it, okay, insurance companies, PBMs, manufacturers, et cetera. But I will say that it is complicated, and yes, I agree that blaming the patients is probably bad form, Representative Halverson. I was a prosecutor for 15 years, and I often encountered situations where there were multiple people who were being looked at to be charged, and they were all blaming each other, okay? Sometimes it was the wasn't me defense, okay? I got that a lot. So as a prosecutor and trying to sift through that, who really was the one to blame, guess who I looked at first? The person who profited the most. And I can tell you that it wasn't 100% of the time that that was the most guilty party, but damn near 100%. So I don't envy the pharma reps that come up here and have to testify. You know, it's a tough job, but come on. We all know where the problem is. So I just wanted to say that, Madam Chair.
All right, one quick question from Representative Noor, and then we're going to vote on the bill. Representative Noor.
I'll keep it brief, Madam Chair. Chair Lesh, don't want to go back to the whole discussion we've had from many Minnesotans, how prescription drugs have gone from small to almost thousands and thousands of percentage higher than what it used to be. So the question that I keep on hearing is that this is unconstitutional, that individuals don't have the right of action to have corrective process when they're being charged and overcharged for prescription drugs that they used to afford. Now they can no longer afford their lives. Can you comment on that?
Sure, absolutely.
Representative Lesh.
Madam Chair and members, Pharma commented on two provisions, including D.C. and the Maryland law. The Maryland law was struck down by the Fourth Circuit, so it's illegal in the Fourth Circuit. We don't live in the Fourth Circuit, okay? We live in the Eighth Circuit, for one, okay? So it's perfectly fine here right now. But second, we drafted our law different from the Maryland law to specifically apply to what the Assistant Attorney General stated, which applies to pharma sales that occur in Minnesota. So it absolutely should not violate the Dormant Commerce Clause. And I'm not going into the Dormant Commerce Clause right now because you'd all fall asleep. But suffice it to say that our bill is constitutional. Thank you, Representative Noor.
All right, thank you. Representative Noor, anything further? Okay. So, Representative Munson, I'm sorry, I think you missed the hearing, and I'm not going to entertain more questions about it because we're kind of concluding now and moving on to the next bill. So the chair renews her motion that House File 4 as amended be re-referred to the Committee on Ways and Means. All those in favor, please say aye. Aye. All opposed, no.
No.
The motion prevails and the bill is on its way. Thank you, Representative Lash.